This presentation is by Amber McLeod, Angelia Oglesby, and Jeannie Kilman of Grayson College over Dorothea Orem's nursing theory, which is the self-care deficit nursing theory. Dorothea Orem was actually born in Baltimore, Maryland in 1914. She graduated from the Seton High School in Baltimore in 1931. She began her nursing education at Providence Hospital School of Nursing in Washington, D.C., where she received a diploma in 1934. She received a Bachelor's of Science in Nursing from the Catholic University of America in 1939. She received a Master's of Science in Nursing Education in 1946. Her nursing experience was the operating room, private duty, like home and hospital. She was a supervisor in the emergency room and biological science teaching. She was a director of nursing at Providence Hospital from 1940 to 1949. She worked at Division of Hospital and Institutional Services for Department of Health for 8 years. Now, her goal was to upgrade the quality of nursing in general hospitals throughout the state. It was during this time that she developed her definition of nursing practice. From 1958 to 1960, she worked on a project to upgrade practical nursing training, and this stimulated the question, what is the subject matter of nursing? Now, as a result, guides for developing curricula for education of practical nursing was developed. She became the Dean of Nursing at Catholic University of America, where her theory of self-care in nursing really developed. In 1970, she left the Catholic University of America and started her first consulting firm. Her first published book was The Nursing Concepts of Practice. In 1979, she received a Doctor of Science from Georgetown University. In 1980, the Catholic University of America Alumni Association Award for Nursing Theory. She also received her Doctorate of Nursing from the University of Missouri in 1998. Some other awards that she's received are the Doctor of Humane Letters, Linda Richards Award, and Honorary Fellow of the American Academy of Nursing. At the age of 92, June 22nd, 2007 to be exact, she passed away in the comfort of her own home from being bedridden for too long. Now, the theory definition is composed of three interrelated theories: the theory of self-care, the self-care deficit theory, and the theory of nursing systems. Now, these are all based off of certain concepts or principles. They are that people should be self-reliant and responsible for their care, as well as family members who need care. Nursing is a form of action, and it's an interaction between two or more people. People are distinct individuals. Now, to successfully meet the universal and development self-care requisites, it's an important component of primary care prevention and ill health. A person's knowledge of potential health problems is needed for promoting self-care behaviors, and then self-care and dependent care behaviors are learned within a sociocultural context. Now, Orm's theory focuses on the individual's ability to perform self-care, which is defined as the practice of activities that individuals initiate and perform on their own behalf in maintaining life, health, and well-being. Gonslow, 2019. Now, the theory of self-care is defined as focusing on individuals who can perform activities of daily living in order to maintain their health and well-being. These actions must be learned. They must be done continuously without pause or interruptions. And they're associated with stages of life, growth, development, energy, and environmental factors. There's 8 universal cares. The first one is maintenance of sufficient intake of air. The second is maintenance of sufficient intake of water. The third, of food. The fourth is the provision of care associated with elimination processes and excrements. And then you have 5, the maintenance of balance between activity and rest. 6 is the maintenance of balance between solitude and social interactions. 7 is the prevention of hazards to human life, human function, and human well-being. And finally, 8 is a promotion of human functioning and development within a social groups in accord with human potential, known human limitations, and human desire to be normal. The theory of self-care deficit is defined as nursing is required when an adult can no longer perform their activities of daily living by themselves. And there's 5 methods of helping. You have acting out and doing for others, guiding others, supporting others, providing an environment for promoting personal development in relation to meeting future demands, and then teaching others. Theory of nursing systems defined. Now, this is how the nurse will meet the requirements of the patient. And there are 3 classifications. You have the wholly compensatory system, which is the person is unable to care. They're socially dependent. Now, this can be a newborn or a post-op anesthesia patient recovering in PACU. Then you have the partially compensatory system, which is they both perform the task or care actions like ambulating a post-op patient down the hallway, bringing a tray of food to a patient who can feed themselves. Then you have the supportive educational system. Now, this system is more of a learn development or learn develop skill where you would counsel a psychiatric patient with coping mechanisms or teaching a new mom how to breastfeed her child appropriately. Now, the implications of the self-care deficit of nursing theory is that it's generally accepted by all the nursing community. It's also involved in international nursing. Now, the theory is used in the basic structure for forming the nursing management in German hospitals, including diagnosis-related group pricing. There's also a new therapy based on the SC-DNT theory that based in nursing where it works with new definitions in German nursing law. There are also landmark models of the therapy used in Thailand. A review of the World Health Organization has a global reference of 326 applications of self-care. Now, it's not 100% her theory, but it does show the implications of the basis of her theory that's being used. There's a base curricula in 7 United States Bachelor's of Science nursing programs, and those 7 universities are listed there. The implications to nursing continue. There's development of self-care agency through enhancement of motivation in people with schizophrenia. Now, in this study, what they do is they use Orem's theory in combinations with others to define and show how people with schizophrenia and other major health issues or illnesses decrease the capacity for self-care, and they need motivation to recognize these deficiencies in ways that nursing can help bring about implementation and action to bring them back to a self-care state. There's the application of Dorothea Orem's theory of self-care to the elderly patients on peritoneal dialysis. Now, what this study shows is how the self-care theory is able to help elderly patients with peritoneal dialysis. And the theory provides the framework for assessment and interventions. And it's regarding deficits in the care related to visual impairment, cognitive function, and comorbidities. Previously, elderly patients were thought not to be good candidates for peritoneal dialysis. And in fact, it shows that this therapy being implemented would be a great benefit to this populace who would not receive these cares otherwise. Now, the critique of the theory. In clarity, the theory is being defined precisely with the same language that's used throughout. There's a consistency in the philosophy and in the action. Now, self care does have multiple different meanings, but in this scenario, it is defined uniquely to Orem's work, yet it is congruent with other interpretations. Now, the early critique stated that there was difficulties with the language, but this no longer seems to apply as more nurses become familiar with the work. Because once the language is familiar, there is an ability to comprehend her view of nursing, the field of knowledge, and field of practice. There's a simplicity to the theory and ability to add or to incorporate into practice. Now, there are a limited number of terms defined. There's 4 constituent theories, such as self care, dependent care, self care deficient, and the nursing systems. The relationship is presented in a simple diagram that's easy to understand. And then the complexity that is needed to describe a human practice discipline, but it's simple enough to understand and actually apply to practice. The references used were listed here. I hope you enjoyed our presentation.